Hi guys, welcome back to this channel. This is Dr. Lovable and you are so welcome to join the family. If this is the first time, please do well to subscribe. Thank you very much. Like, share, and don't worry, you will not regret joining this family. So quickly going over to the case of today, we had a case of a 20-day-old female, a neonate, which was brought to the emergency room on account of severe weakness and inability to suck. Looking at this baby already, we could see that this baby had hydrocephalus, which is like the swelling of the head. You can see that the head was big. We asked the mother, okay, so what happened? What brought you to the hospital? She mentioned that all of a sudden her baby was just acting weak and weak. So it was when she noticed that it was getting too much, that was when she rushed down to the hospital. Asking her further about the prenatal, natal, and postnatal history, she mentioned that she gave birth to the child in the health center. And when she gave birth to the baby, there was a swelling at the back of the baby. Being that she gave birth in the health center, she was told that it's something that would resolve on its own. But since they went home, fluid has been leaking from the bulge, from the swelling, and they've been cleaning it, only for them to find out that the child was getting sicker and sicker, then bringing him down here to the hospital today. So we opened up the baby and looked at the back and we saw the swelling, but this was not a regular swelling. This was what we call spina bifida, and the fluid that was leaking was CSF. So this brings us to our topic for today. Spina bifida is a neural tube defect. In embryology, there's what we call the neural tube, and as development progresses, it fuses and closes to form what we know as the spinal cord. But in this case, there is a defect. It does not close completely, leaving a hole. So now this brings us to the three types of spina bifida. We have the spina bifida occulta, we have the meningocele, and we have the myelomeningocele. These are based on their levels of severity. The spina bifida occulta is, just as the name implies, it's occult, it's hidden. There is a defect, but it's not so big enough to cause a bulge at the back. So you will just see the small dimple or discoloration at the baby's back, but there is no visible bulge. That particular one doesn't really come down with complications, so it's usually live normal lives. Then the second one we have is the meningocele. In this case, the meninges forms a bulge, and that bulge, because of the bulge, is like a pouch. So the CSF flows into that pouch, causing that bulge. That is the meningocele. Then the next one we have is the myelomeningocele. It's a form of meningocele where the myelo, which is the nerves, are also in the bulge. So apart from the CSF, which is in the bulge, the nerves also follow that. And this particular one is the most severe form of this condition. Research has shown that the major cause of this condition has not really been found, but there are things that increases risks of coming down with this condition. Number one, and very important, is low levels of folic acid during early pregnancy. The importance of folic acid cannot be overemphasized. Folic acid is that tiny yellow drug which you're given during your antenatals. Research has shown that during pregnancy, when you take these drugs, it reduces your risk of having neural tube defect. I asked my patient if she took antenatal drugs, and she mentioned that she didn't take her drugs during that particular pregnancy. Why? Because she said her neighbor told her that she didn't take the drug and her baby came out normal. Many people she knew didn't take folic acid and their baby came out normal. But I want to let you know something. Everybody is different. You are not the same with your neighbor. Neither are you the same with your sister or your mother. Every pregnancy on its own is also different. That aside, the next risk factor is family history of neural tube defect. In this case now, since this woman has already had a child with a neural tube defect, she's at increased risk of having another child with neural tube defect. So we counseled this woman on the need to start folic acid early, even before she conceives. The importance of this drug is usually during early pregnancy. So the next risk factor is maternal diabetes. Uncontrolled maternal diabetes. It comes down with so many complications, of which neural tube defect is also one of them. Then we have so many others. So some of the complications of this condition include, number one, there is going to be bowel and bladder dysfunction, more of incontinence. This child we saw already came down with this complication. Now what happens, especially in myelomeningocele, due to the fact that the nerves are involved, there is usually nerve damage, and once that nerve root is damaged, the organs down becomes paralyzed. So there is paralysis of the nerve that controls the bladder and the bowel, causing that incontinence. Aside that, there's also paralysis of the leg due to the fact that those nerves also control leg movement. This child we saw came down with all these complications. Other complications include hydrocephalus and some other social complications. Management of this condition is more of automatic. You manage the symptoms or you manage the complications. However, the occulta doesn't need treatment because it is not symptomatic. It's just there. While for the meningocele and the myelomeningocele, early surgical intervention to close the defect can give a better prognosis to this disease. So please, my mothers, please and please, folic acid is very important during pregnancy. It is very important. Like I said, the importance of this drug cannot be overemphasized. Start taking folic acid while you are trying to take it. And whenever you have noticed that, oh, you are pregnant, immediately start folic acid, even before you start with your antenatals. I hope you've learned from this video, and I hope you would share this to people who need to hear about this. Thank you very much. Bye.